question I used to get a lot in the hospital is my baby born hungry? So let's talk about it. I'm Abby, a certified lactation educator and a labor and delivery nurse, and I love helping pregnant moms feel more prepared before they even get to the delivery room. Okay, so does your baby come out hungry? The answer is not in the same way that an adult would be hungry. So when your baby's in your belly, they're getting a continuous supply of glucose through your placenta. So they're constantly getting fed and nourished. But once baby comes out and they're not attached to the placenta anymore, that glucose goes away. So in the first couple hours after birth, their glucose is going to go down. But luckily, they're born with glycogen stores, which break down and are able to satisfy your baby until breastfeeding is well established. So your baby doesn't come out starving. It is good to start doing that first breastfeeding in the first hour or two after birth because babies are generally very awake and ready for feeding. And it's great to get that practice in. And a healthy term infant is also going to show you some cues that they're ready to feed, like rooting, sucking, putting their hand in their mouth, things like that. Plus, that early feeding is going to help kickstart your milk production and help stabilize baby's blood sugar so it doesn't get too low. So a healthy term baby can usually tolerate a few hours without being fed, but it is good to get that first feeding in within the first hour if you can. And then feed them on demand at least 8 times in a 24-hour period. Some babies might come out and want to eat very vigorously right off the bat, and some babies come out more sleepy and might not be so eager to feed right away. All this being said, there are some medical conditions where it is imperative that you get feeding done early, like if baby ends up being too small for their gestational weight, if mom has gestational diabetes or any other kind of diabetes, if baby's preterm. These babies do need to be monitored a little bit more closely because they are more at risk for hypoglycemia, which is low blood sugar. So happy nursing and follow me.